This is Bob Maranto, Managing Partner of Andrews, Bernstein Maranto, continuing our discussion regarding certain types of doctors that you may see if you've had a spinal injury in a motor vehicle accident case. Next, I'd like to talk about pain management doctors, or what we call PMR doctors. And pain management doctors are really called in to help not so much with respect to curing the problem, but to help with the symptoms that you're suffering from. You know, I myself had suffered from low back pain before, and it can be incredibly debilitating, and a lot of people, unless they've experienced it, don't understand how horrible it can be. And sometimes while you're going through chiropractic or you're going through neurology or physical therapy, the pain is just so significant that doctors need to do something to help. And what pain management doctors do is that they can prescribe medications. And chiropractors, physical therapists, they're not prescribing medications. They're not allowed to under our laws. So a pain management doctor may give you a painkiller in certain circumstances, not that often. In certain circumstances, they'll give you muscle relaxants. The muscle relaxant will take the muscles in the affected area and loosen them up so the body can try to help heal itself. In addition, and what I will talk about is injection therapy. So oftentimes what will happen is that this community will use injections to try to alleviate some of the pain. There are trigger point injections that are used, and trigger point injections are more muscular in nature, where they're injecting into the areas that are affected. They're not as penetrative. They don't penetrate as much as epidural injections, and there's usually a multitude of them that are provided to try to get some relief. Epidural injections can come in a number of fashions. They are injected deeper in, and they're usually a painkiller and a steroid compound. The steroid is used, well, the painkiller is obviously used to kill the pain, and the steroid is used to shrink inflamed material. So if any part of the body has inflammation in it, then you use a cortisone to reduce that inflammation. Sometimes selective epidural injections are used, and they'll actually catheterize people, use a little camera, and they come in, they'll actually inject right here into the nerve sheath. And it's important, if that's being done, that you understand that that's not only therapeutic, trying to give you pain relief, but it's also meant as a way to diagnose. Because if there is contrast, the material is injected under the nerve sheath, and you have a reaction to it, then they know, in addition to an EMG potentially, that that nerve has been affected. And if that nerve has been affected, we can now narrow it down to something that has to be addressed by either more injection therapy or through neurosurgery or orthopedic surgery.